My name's Angela, and I'll be presenting our GSK case study. Sustainability is a universally recognizable theme. Most people equate it with environmental sustainability, which is what our theory applies it to. But it also applies to individual decisions and even business practices. This case deals with the practices of GlaxoSmithKline and their dealings with AIDS victims in poor countries, specifically South Africa. AIDS is a disease spread through the exchange of bodily fluids. This can be through sexual contact, blood transfusions, contaminated needles, and during birth from mother to infant. Once contracted, HIV spreads through the body, attacking its immune system and preventing it from being able to fight off normally simple illnesses. Beginning in 1980 in the United States, more than 200,000 people fell victim to the disease within the first 10 years of its emergence. With no effective treatment available at the time, most people died once infected. By 1987, more than 127 countries had reported cases of HIV. The disease saw its decline in the United States during the 90s, with reported cases dropping from 80,000 people in 1993 to only 21,700, 7 years later in 2000. While the United States was enjoying remission, the rest of the world was experiencing catastrophe on a global scale. 40 million people were infected with HIV/AIDS, while 20 million people had died from the disease. Africa alone had harbored 25 million infected individuals. In the year 2000, South Africa had the highest concentration of HIV-positive individuals in the world. With more than 5 million people suffering, it was predicted by healthcare officials that by 2010, that number would grow to more than 7.5 million people. Conditions in Africa lent themselves to rapid spread, and it was estimated that by 2015, more than 30% of children in Africa would be orphaned by HIV/AIDS. In 1998, the average income in Africa rested around $2,000, with a year of HIV/AIDS treatment costing about $14,000. The stark contrast between income and expense meant that an HIV/AIDS diagnosis was almost always a death sentence. The lack of affordability, coupled with the unsatisfactory living conditions, gave way to an epidemic of HIV/AIDS-related death, and even though the medication existed to treat the disease, it remained out of reach for most of the population of South Africa. In an effort to help their people, South African politicians launched a policy that allowed them to waive the intellectual rights of pharmaceutical companies and offered generic versions of medicine for cheaper and more affordable options. Waiving the intellectual property rights of the pharmaceutical companies meant that generic versions were available for about 2% of the patented price. Pharmaceutical companies lashed out at the South African government, levying a lawsuit where they claimed their rights were being violated by the South African government. GlaxoSmithKline, GSK, the leading producer for AIDS medication, launched into a campaign to retain their pricing in South Africa and other poor countries like it. GSK argued their pricing was fair and necessary in order to make up for the high cost of research and development of new drugs, including AIDS medications. GSK claimed lowering prices in South Africa would limit their ability to charge fair prices elsewhere. GSK argued while they were already doing their best to aid the suffering people of poor nations like South Africa. Despite global patent protection policy, there was a huge public backlash. GSK and other pharmaceutical companies were targeted by nonprofits and patient rights groups. The nonprofits argued that GSK and others like it were nothing but greedy and pointed to the low costs of production, claiming they were taking advantage of the plights of the people, preying on humans for profit. The image of big pharmaceutical companies ignoring the plights of dying South Africans was too disturbing for the public, and despite numerous attempts to save their public image, GSK was seen as the bad guy. GSK and their compatriots had billion-dollar profit margins, and in the public eye, that money was made on the backs of sickly, dying, and defenseless citizens of third-world countries. GSK continued to point to their philanthropies, medical aid to sub-Saharan countries, price reductions for nonprofits, and eventually they even cut their prices by over 93%. However, it was way too little, way too late for GSK. Millions of Africans had died due to the unavailability of medication, and the public placed the blame solely on the back of GSK and other pharmaceutical companies. The blame game continued, and millions of South Africans are still waiting for access to life-saving medication.